Merci, Madame la Présidente. The following messages are messages I recently received from constituents without health care providers. Quote, I've been on a wait list since 2019 for a family doctor with a child who is 1 year old. I'm unable to see HealthLink in times of need, and appointments take up to 9 weeks. I was enrolled in MB HealthLink in January 2023. I check the availability of a doctor every day and have done so since last December. In February, the first appointment I could get was in May. Another one, HealthLink books in 2-week blocks. I've been trying to book an appointment every 2 weeks for the last 6 months. No luck. Madam Speaker, last week I was asked whatever happened to all the new clinics this government had promised to build so people can have a doctor. Can the Minister of Health tell me what my constituents are supposed to do besides continue to wait?
I recognize the Minister of Health.
Madam Speaker, to the member opposite, this is a problem. I would agree with you. There are many people today, perhaps in the People's House, that do not have family doctors, let alone your constituents. And this is one of our government's passions, to get those people attached. You know, the HealthLink was put in place as an effort at dealing with over 180,000 people without doctors. It's helped some, but not completely. We are attaching more people on the north side. We have efforts at attaching people on the south side as well. There's a clinic that's set up primarily for Francophonie that does not have health care providers at present. So I accept your challenge. We have not met that everybody attached within our first 6 months of government, but we've gone a long way and we will continue working on it. Thank you very much for your encouragement.
I recognize the Leader of the Third Party.
Madam Speaker, there are more people in Fredericton by far without a family health care provider than anywhere else in the province. 60% of the people on MB HealthLink's waiting list provincially live in Fredericton. 60%. In March, it was announced, 10 internationally trained family doctors were joining our, oh my goodness.
We will allow you a few more seconds.
Thank you. In March, it was announced that 10 internationally trained family doctors were joining our healthcare system to be deployed in Moncton, Campbellton, Bathurst, and Miramichi. Last summer, Horizon hired 44 new physicians, and only 1 was assigned to Fredericton, which had just lost 3 family doctors. There's clearly a bias against the capital city by government after government after government, whose members wrongly believe that we get priority treatment for government services. If I'm wrong, can the Minister explain, when it comes to health care, why is the priority given to virtually anywhere except Fredericton?
Je reconnais le ministre de la Santé.
Madam Chair, to the member opposite, I'm glad for this opportunity to explain that Fredericton, Dr. Everett Chalmers Hospital, the community at large, is one of the gems in our crown of health care. There's been recent renovations in the operating room at the deck. We are working hard to make sure that this is the most modern operating room in the region, in the Maritimes. And we are very aware of the significant deficit of primary care in Fredericton. It is one of our tasks. The first cohort of the practice-ready assessment were meant to deal with more of the periphery of the province. There's a second cohort being assessed currently, and we are hopeful that people will come to Fredericton. I mean, it's a beautiful town. We have a very engaged talent recruitment team that are trying to get people here. The community is very engaged to try to bring people here, show them a good quality of life. We have not fixed this yet. I agree with your comments. There's an inappropriate, unusual demand for primary care in the core of Fredericton, and we will work hard to address it.
Je reconnais le chef du tiers parti.
Madam Speaker, I'm concerned this bias will continue under the new government because we have a premier from Fredericton, and I fear we will be even less of a priority when it comes to health care for fear that she will be accused of playing favourites. I ask her to prove me wrong. The Premier has been travelling the province, rebranding existing community health centres as collaborative care clinics, or I guess now family health teams. This, so far, is not solving the health care crisis. It's time to build as she promised. If collaborative care clinics or family health care teams are the solution to the crisis in accessing primary health care, can the Premier say, other than the Northside Community Health Centre, how many clinics will she build in Fredericton and by when?
Je reconnais la Première ministre.
Thank you very much, Madam Speaker, and thanks to the member opposite for the question, and thanks for recognizing the challenge of doing things in the Premier's riding and the perception of special treatment that can sometimes lead to. But as the Minister said, Fredericton is underserved. It is one of the communities that has the highest number of people that find themselves on the wait list for family doctors, and I think it's next only to the area of Edmundston and up in Madawaska, and so that's one of the reasons why it was the first place that we announced more people coming off of the waiting list, to take extra patients and to add extra resources and healthcare professionals and expand the space and build more space at the Fredericton North Side. The work does not stop there. Fredericton will continue to be a place where we look for partners who are willing to work with us to build family healthcare teams on the south side of Fredericton. We've been having many conversations with family physicians, with pharmacists, with the regional health authorities, with others